everyone, so let's move towards our today's topic, which is
rectum. Now we have already discussed in the separate lecture that is what is large intestine. We have already discussed about the stomach. We have already discussed about the small intestine. In this lecture, like I said, we will gonna talk about rectum. Rectum is basically, you can say it is the second large part of the GIT. Okay, after rectum, after sigmoid colon, basically it is the continuation of the sigmoid colon. We all know that transverse colon, ascending colon, descending colon, then sigmoid colon, and then sigmoid colon opens into rectum, and then after rectum anal canal is present, which we have already discussed in the separate lecture. Now the rectum starts at the level of third sacral vertebrae, and between the sigmoid colon and the rectum there is a junction called as recto-sigmoid junction. Okay, it is basically to differentiate the parts of the GIT. The junctions are present. Okay, now the rectum is basically it is not a straight tube. Okay, it consists of many curves. Okay, lateral curves होते हैं, बहुत सारे और कर्व्स होते हैं जो कि बुक में लिखे हुए हैं, इंटरनेट पे मौजूद है, बट अकॉर्डिंग टू मी इट्स नॉट मच इम्पॉर्टेंट. बट यू हैव टू रिमेंबर दिस पॉइंट दैट देयर आर मैनी कर्व्स विच आर प्रेजेंट ऑन rectum. Now anteriorly rectum consists of intestine and urinary bladder in male, and in female intestine and vagina is present. Anteriorly in male urinary bladder is present, and in female vagina is present. Posteriorly in both male and female sacrum and coccyx bone and piriformis muscle is present. Okay, now one more thing which is very interesting, that the whole rectum consists of mucous membrane. That mucous membrane forms fold. Those folds are called as longitudinal folds and the transverse folds. In this first of all we will gonna talk about longitudinal folds. Longitudinal folds are present in the lower part of the rectum. Okay, now that's it. You have to remember that longitudinal parts are in the lower part of the rectum. L for longitudinal folds, L for lower part of the rectum. Now the transverse folds are basically of three types: the first transverse fold, the second transverse fold, and the third transverse fold. The first transverse fold is on the left wall and it is present in the upper region. The second transverse fold is on the right side and it is the largest fold. Okay, remember this point. The MCQ may come in the exam that which is the largest transverse fold, so the answer is second transverse fold. And the third transverse fold is on the right side, and it is in the middle region of the rectum. Now these are very short topics. Okay, rectum हो गया, anal canal हो गया, बुक में बहुत लेंदी लिखा हुआ है, लेकिन वो सारी चीज़ें बहुत इम्पॉर्टेंट हैं तो सही, वो सारी चीज़ें समराइज़ करके मैं आपको बता रहा हूँ. ठीक है. Now rectum, obviously the blood supply of the rectum is through superior rectal artery, middle rectal artery, and the median sacral artery. Okay, superior rectal artery, यही obviously ये arterial supply, but the venous supply is same like arterial supply. For example, the venous supply will be superior rectal vein, middle rectal vein, and the median sacral vein. The nerve supply, the rectum is obviously innervated by some nerves, and that is L1, L2, S2, S3 and S4. Remember these points which are very much important. Okay, and one more thing, that superior rectal artery basically arises from the inferior mesenteric artery. The middle rectal artery arises from the internal iliac artery, and the median sacral artery arises from the back of aorta. It is a very small branch. So remember this point, which is very much important. So this was the whole topic regarding rectum. Till then, work hard, study hard, and good luck. Take care. Bye bye.